And here is the muscles of the legs. So superficially you can see gastrocnemius or gastrocnemius. Both pronunciations are correct. It has two heads. Gastrocnemius cause flexion of the knee and also cause plantar flexion. Okay, if you remove this, then you can get some other muscles. One is called plantaris, that can cause flexion of the knee and plantar flexion of the ankle area. Another muscle is called Popliteus, that is located behind the knee, that can cause flexion of the knee. And another muscle is called Soleus, that can also cause flexion of the plantar area or plantar flexion. Okay, plantar flexion also anatomically is called ankle extension. So the same thing, ankle extension is the same thing as plantar flexion. Okay, gastrocnemius, soleus, and another muscle that is called the tibialis posterior, and these three muscles also cause inversion of the knee, inversion of the foot, I mean, inversion of the foot, okay, moving the foot medially. Tibialis posterior also cause plantar flexion. So there are multiple muscles that can cause plantar flexion. You have gastrocnemius, you have the plantaris, you have soleus, and you have tibialis posterior. You also have two other muscles, fibularis longus and fibularis brevis. Okay, these two muscles also cause plantar flexion. For inversion, okay, you have the gastrocnemius, you have soleus, and you have tibialis. There's a couple of muscles that can cause eversion, so moving the foot outward, and these are called fibularis longus and fibularis brevis. Couple of muscles that are there for moving the toes. So this is the flexor digitorum longus. These are the tendons, and this is the muscle. And flexor hallucis longus, that is going to the big toe. Hallux is the big toe. So these two muscles cause flexion of the toes. This is the anterior view. So in the anterior view, you can see tibialis anterior, located in the very close to the tibia, and that can cause a dorsal flexion. Okay. There is also extensor digitorum longus is there, and that can cause extension of the toes. And extensor hallucis longus is there, and that goes to the big toe and cause extension of the big toe. You also have these retinaculae. So these are called extensor retinaculae, that's located on the anterior part of the ankle. These are the side views of the leg area. So you can see gastrocnemius, soleus. Below that, both of them together makes the calcaneal or Achilles tendon, both of them together. You have fibularis longus and fibularis brevis here, and anteriorly you have the tibialis anterior, and then you have the extensor digitorum longus muscle is there, and extensor hallucis. It's a little bit difficult to see. Here is tibialis anterior, you can see it, and posteriorly gastrocnemius, soleus is there, and also tibialis posterior is easy to see it. So this is the extensor retinaculum again, but for the flexor retinaculum, you have to see it in a different view. Okay. So again, this is the extensor retinaculum. So they have the superior one, and you have the inferior one. Some muscles that are there. This one is called extensor hallucis brevis. So called extension of the big toe, and this is the extensor hallucis longus. So it's coming from the leg. These ones that you see, this is like an oblique view. This is extensor digitorum brevis, these ones, and these ones that you see, these tendons are extensor digitorum longus. Okay, so these are the longest ones, extensor digitorum and extensor digitorum brevis is these ones. And these are the dorsal interossei muscles between the bones. Okay. Then the plantar surface of the foot. So you have the important muscle here is called flexor digitorum brevis, that is located above the tendon of the flexor digitorum longus, that is coming from the back of the leg area. You also have some muscles for the big toe. So this is the abductor and this is the flexor, hallucis. And for the small toe, you also have the flexor here and the abductor here for the digiti minimi. So if you remove the flexor digitorum brevis, the important muscle that you see here, that is called the quadratus plantae. Okay, quadratus plantae. Also superficial to quadratus plantae and flexor digitorum brevis, you see that plantar aponeurosis, that is a supporting connective tissue for the plantar surface of the foot. You also see these ones, and these are the lumbricals, similar to the hand. You have lumbricals in the foot. And